Well, I just want to, Susan, thank you so much. I want to say happy Tuesday. So for all you preschool teachers out there, you're celebrating 2/22/22. So welcome today. I hope everyone had a good long President's Day weekend. This is the first training of the year for the Mid-Cumberland Council on Children and Youth. And so we are so happy that you have joined us. If you're in the council, we thank you for your membership. And if you're not part of a regional council with TCCY, we would highly recommend that you become one so that you can come to great trainings like this one today. And so, as Susan said earlier, if you're just joining us, please enter your name, organization, and email in the chat box so that we can have a record of your attendance. We really wanted to bring this training to you today to review the State of the Child report. It is a report that TCCY helps compile every year. It's very important, but it's pretty dense. And so there's so much good information, I think, that will be insightful for the work that you do with children, youth, and families. And we invited Kylie Graves with TCCY today to present that and also to give us some information on the policy briefs that TCCY has for us this year. So she will be presenting, and then towards the end of the presentation, she will save time for questions. But if you could please remember to keep your mics turned off during this presentation, it will help everyone hear better. We won't have feedback. So I would like to introduce Kylie Graves. She received her undergraduate degree in social entrepreneurship from Belmont University. She went on to complete a Master of Science in Social Work from the University of Tennessee. She began working as a communications and policy specialist with Tennessee Commission on Children and Youth in 2020 and appreciates the opportunity to advocate for the well-being of children, youth, and families in Tennessee. And we welcome you, Kylie, and we're so glad to have you here educating us today.
Hi, all. Okay, let me share my screen and get my presentation up. But like she said, my name is Kylie Graves, and I'm super excited to present to you all. We're going to go over the State of the Child in Tennessee, which is a report we released back in December now. And then also towards the end, we'll go over some of TCCY's policy briefs and about the detail with those. So I am excited to talk with y'all today. I do have a dog who hates the rain, and it just started raining. So you might hear some barking throughout the presentation, but hopefully she just sleeps through it. So the State of the Child, Tennessee Commission on Children and Youth, is the state level partner for the Annie E. Casey Foundation and their Kids Count Network, which collects and provides data all across the nation on a national, state, and county level and school district level. And so each year we provide the State of the Child, which gives an overview of how kids are doing. And so we're going to talk about that report. In the 2021 State of the Child, the broad topics that we addressed were the demographics of Tennessee, special topics, which we'll go into a few of those, economics, education, health, child welfare, and youth justice. And so some of the special topics we looked at were COVID-19 and its impact on children, ACEs, some new data the foundation has been collecting around youth and young adults, and then all these other topics here are kind of broken in between those different broad buckets. So first, at this is what the State of the Child looks like as far as pages go. We did kind of a remodel this year. So on the right here where you see poverty, that's just an example of one of the pages. We really wanted it to be engaging, easy to read. This report, as well as I know this presentation, is going to be really data heavy, but we try to make it accessible for people who aren't typically as into data. And so I'm going to share this quick video and see if that works for you all. And this just goes over some of the key data from the State of the Child.
Kylie, I'm not hearing it.
Okay, it's just some music, so if you're not hearing it, that's fine. You can just imagine some music going through. I may have not shared it my screen properly. Okay, so that is kind of just an overview of the data that we're going to get into. And then that link to that is in the chat. I can put it in at the end of the presentation as well, because I think it kind of got buried. But as we go, if you all have any questions, feel free to put them in the chat. While I'm presenting, I can't see it, but we'll be sure to go back through and answer those questions at the end of the presentation, but I don't want you to forget anything. So then with 2021 and the pandemic, we did run into quite a few data challenges. We typically get a lot of our data for the state of the child from the Census Bureau, and the Census Bureau's American Community Survey, as well as several other surveys they did, experienced extreme challenges in data collection due to the pandemic, due to mail issues and things like that. So a lot of the typical indicators that we used in the state of the child weren't available, and that data has been delayed until March while they do some external validation and make sure it's all reliable. So we compiled data from a lot of community, national partners. The majority of the data in this book spans from 2019 to 2021. We took the most recent available data that we could for each indicator, but sometimes we didn't have anything earlier than 2019. And then unfortunately, due to the lower sample sizes, we couldn't always break out the data by different demographics, such as race, ethnicity, rural versus urban. And then additionally, because we were using different indicators, we couldn't really compare it to previous years as often because those indicators weren't yet available. We're hoping once we get that Census Bureau data in March, I think it's releasing late March, that we could do some sort of update with those updated numbers. And so when we look at demographics, out of 100 Tennessee children, 64 are non-Hispanic white, 19 are non-Hispanic Black, 10 are Hispanic or Latino, 4 are non-Hispanic 2 or more race groups, 2 are non-Hispanic Asian, and then 1 child would be non-Hispanic Native American, Alaskan Native, Native Hawaiian, or other Pacific. And so as we're looking at data and thinking about overrepresentation or underrepresentation or access, having this picture of what the racial breakdown in Tennessee is like has always been really helpful for me. And so as Tennessee's children are becoming increasingly diverse, which we're seeing, since about the last 20 years, we've seen 5 counties become majority children of color. That's up from, I believe it was 3 in 2000. So as Tennessee is becoming increasingly diverse, equitable access to economic opportunities, education, healthcare, and justice have to remain at the center of our systems, policies, and programs. So when we're looking at diversity, another thing is Tennessee children who are in an immigrant family. So we have 1 in 8 Tennessee children are part of an immigrant family, with the majority of those coming from Latin America, followed then by Asia, Africa, and Europe. And then additionally, 1 in 10 Tennessee school-age children speak a language other than English at home. And so when we're thinking about access to resources or outreach for programs, really thinking about the diversity of language in Tennessee, and making sure that we're making those outreach accessible. And so as we look at COVID and looking specifically at COVID's impact on child health, nationally, we saw a trend of outpatient medical visits among 3 to 5-year-olds drop in 2020. So the blue line is the typical year trend. And you can see at the beginning of 2020, the orange line is really tracking along with that, how we typically go. And then at about the 12th to 16th week of 2020, we see a drastic drop in 3 to 5-year-olds visiting or pediatric care. And so this is nationally, but we saw similar data in Tennessee. In Tennessee, there was a 62% decline in pediatric visits in April 2020 compared to March 2020. And then additionally, in April 2020, child vaccination rate was 39% lower than April 2019, so than the same time the year previous. And so while child visits and immunizations are critical to supporting healthy and safe childhood development, and so that drop during the pandemic is really concerning and something that we want to make sure gets back on track as we move through recovery from the pandemic. And then additionally, another huge issue impacted by the pandemic was childcare. In August of 2021, half of households with young children experienced a disruption in care due to the pandemic. And then similarly, households with children under 12, about 2 out of 5 of those experienced a disruption. Half of parents who experienced this disruption in childcare either took unpaid leave or cut work hours. We saw a disproportionate number of women leaving the workforce and not returning. And all 3 of these things impact families' income as well. And so when we talk about family income and economics, in September of 2021, 42% of households had difficulty paying for usual household experiences. And this was actually an increase from September 2020. So in the second year of the pandemic, we saw an increase of 12%. And then prior to the pandemic, we saw that nearly half of all Tennessee families were struggling financially, and 1 in 4 families were receiving financial assistance to help provide basic needs for their children. And then the child tax credit began in July, and in October, the child tax credit helped support more than 700,000 Tennessee families and ensure that over 1 million children had their basic needs met. It lifted 1 in 7 Tennessee children out of poverty. And that 1 in 7 children is not specific to children who are already in poverty. It's 1 out of every 7 kids in Tennessee was lifted out of poverty. And 91% of Tennessee low-income families used that tax credit for basic needs, such as housing, rent, food, clothing, and then also educational needs as well. And so when we look at housing, that's another area that Tennesseans really struggle with. There are approximately 66% of extremely low income housing or houses are spending more than half of their income or rent on housing. So they're spending half of their income that's classified as extremely housing burdened. And then in August of 2021, 1 in 5 Tennessee households had little to no confidence in their ability to make their next housing payment on time. And of those households, half were very likely or extremely likely to face eviction or foreclosure within the next 2 months. And this data was an indicator that had been asked over several since the beginning of the pandemic, starting in March 2020. And we saw that number of households who were very or extremely likely to face eviction increasing when the eviction moratorium was stopped. And so see that there's an increased risk of students experiencing homelessness. And when we look at students and education and looking at TN ready testing among 3rd through 5th graders, 1 in 4 students scored on track or mastered in math. 1 in 3 students were on track or mastered in reading and language. And then 2 in 5 scored on track or mastered in science. And then overall, 65% of Tennessee fourth grade students rated below proficient in reading. And we saw disparities in this data. The largest disparity is with students with disabilities and students eligible for free and reduced lunch. And those numbers were 85 and 82% respectively. And additionally, in the 2020 to 2021 school year, 1 in 4 districts met the goal of 1 certified social worker for every 1,500 students. The National Association of Social Workers recommends a ratio of 1 to every 250. So our goal is quite a bit higher than the recommendation by the National Association of Social Workers. Similarly, a little over 1 in 3 districts met the goal of 1 certified psychologist for every 1,000 students, and the National Association of School Psychologists recommends a ratio of 1 to 500, so about half that. And then when we look at infant and early child care, really the focus we take on this is that it needs to be accessible, affordable, and high quality to be effective. And so when we look at accessibility, 48% of Tennesseans live in a childcare desert, and a childcare desert is defined as having no childcare slots or 3 children for every 1 available slot. And we saw a significant increase in those living in a childcare desert when they were in rural areas with 62%, and the lowest percentage was in suburban areas at 40%. And then when we look at affordable childcare, high quality childcare is instrumental in supporting childhood development, as well as Tennessee's workforce, which is a huge issue, we know. But the costs of it put it out of reach for many Tennessee families, even those that have both parents participating in the workforce. And so the Department of Health and Human Services defines affordable childcare as 7% of a family's income. And by that standard, only 1 in 7 Tennessee families can currently afford childcare. If we capped the costs at 7% of a family's income, that measure of affordability, the average Tennessee family would save about $14,500. And currently, infant care in Tennessee costs more than in-state public university tuition. And if you were a minimum wage worker working in Tennessee and you needed to provide childcare for your toddler or infant, you would need to work full-time from January to July, paying for nothing else but childcare in order to afford costs for that year. And then when we look at early childhood or high quality early childhood education, it can support the development and social emotional skills while increasing school readiness. But only 1 in 3 childcare providers in Tennessee are licensed by the Department of Health and Human Services or the Department of Education. And then even fewer, 1% of those licensed have national accreditation. So when we look at early investment, we know that investing early is the most effective. Economist James Heckman and the Heckman equation have shown the benefits and the increased dividends of investing in those early 0 to 5 years. And we've seen investment increase in the form of the rate of children receiving Tennessee early childhood intervention services. In the last decade, that number has essentially doubled from 16.7 to 33.9 per 1,000. But Tennessee does fall behind in the rest of the country in the percentage of young children who are not in school. We're at about 60%, and that's one of the highest rates in the country. Additionally, resource mapping data shows that even though investing early in childhood provides the greatest benefit, Tennessee isn't even investing an equal amount in terms of children under 5 were approximately 27% of all children in the state, but they only made up about 14% of all state expenditures for children. So we're underspending on a place that has the most return on investment. And then when we look at mental health, we found some really concerning data in mental health in Tennessee. And so Mental Health America ranks the states. Tennessee falls really far behind in terms of youth mental health and access to care. ranking 40th out of 51 in youth mental health and 45th out of 51 in access to care. Another poll that we saw was in 2019 and 2020. Vanderbilt Child Health Poll asked parents if their children age 6 through 7 had been diagnosed by a mental health professional for any of the listed concerns. That includes suicidal thoughts or intentions, substance use disorder, stress, self-harm, PTSD, oppositional defiant disorder, eating disorder, depression, bipolar, autism, anxiety, or ADHD and ADD. And so the blue lines on this graph are representative of the parents or the children who had been diagnosed. And then additionally, Vanderbilt Health Poll asked if the parents were concerned that their child may have one of the conditions, but hasn't yet been diagnosed. And so we saw the largest percentage in both of these in anxiety, with about 1 in 10 children being diagnosed with anxiety, and approximately another 20% of parents concerned that their child may have an undiagnosed anxiety disorder. Then additionally, when we look at teen mental health, we found really alarming statistics in terms of teen suicidal ideation. A survey of Tennessee high school students showed that 1 in 5 had seriously considered suicide within the last 12 months. 1 in 7 had made a plan about how they would attempt suicide. 1 in 10 actually did follow through and attempt suicide. And then 1 in 25 of those had a suicide attempt that resulted in an injury, poisoning, or overdose that had to be treated by a doctor or nurse. And all of those were just asking the student about the last 12 months of the survey. So it's not a lifetime data. This is just within the last 12 months. This survey was conducted pre-pandemic. I believe this data comes from 2019. And so when we're looking at that in the previous Vanderbilt Child Health Poll, when they asked parents about their concerns of an undiagnosed mental illness, 1 in 10 parents said they were concerned that their child had suicidal thoughts or intentions, but also 1 in 10 weren't confident in their ability to identify the warning signs of suicide. The highest risk factors that we found in this survey were being female, being Hispanic or Latino, or a sophomore, and that increased the percentage to about 19% had made a plan of how they would attempt suicide. And that indicator about a plan of how they would attempt suicide increased by 50% since 2007. Once again, talking about 2007 to 2019. And then teen substance use is on the decline, and in Tennessee, it's lower than the national average, with the exception of teen use of nicotine and tobacco. That is higher than the national average. And although we're experiencing this decline, there's been an alarming increase in fatal overdoses. Fentanyl was involved in 80% of overdoses among Tennesseans 15 to 24. And since 2017, the number of youth and young adult overdoses from fentanyl has increased by 230%. And then additionally, there was about 4,000 non-fatal overdoses that occurred in that time frame. And then 15%, so about 1 in 7 Tennessee high schoolers had responded on a survey saying that they had ridden in a car within the last month where the driver had been drinking alcohol. And so when we look at overall health, getting into the health section here, more than 1 in 5 Tennessee children have special health care needs. When we're looking at K through 12 students with a chronic illness or disability diagnosis, the most common are asthma, ADD or ADHD, and severe allergies. And then when we're thinking about that mental health data that we just went through, more than half of Tennessee's children with a diagnosis didn't receive treatment or counseling. So access to care is a huge struggle when only half of those who actually do have a diagnosis are receiving care. And then we saw that increased percentage of parents who were concerned that their child had a mental health condition, but they had not yet received a diagnosis. So there's a lot larger of a percentage of children who aren't receiving the care that they need. And then we're seeing that reflected in those higher rates of mental illness among Tennessee high schoolers. And then additionally, in 2020, 78% of children had not received their full series 78% had received their full series of recommended vaccinations at 24 months. So at the beginning, we had talked about that decrease in well child visits and how critical those well child and immunization visits are. So really concerned about the impact of the pandemic on that. And then despite the risks that the flu presents to children under 2 and the benefits that the flu vaccine has, only half of Tennessee children under 2 had received at least 1 dose, and less than 1 in 3 received all 3 recommended doses. When we're looking at access to care and insurance coverage, half of Tennessee's youth are insured through TennCare. And additionally, we'll talk about maternal health care as well in just a little bit, but half of Tennessee's births are insured through TennCare as well. And so 80% of uninsured Tennesseans reported that they were uninsured because they could not afford insurance. And in fall of 2020, Vanderbilt Child Health Poll found that the percent of uninsured children in Tennessee had more than doubled. It went from 4% in 2019 to 9% in the fall of 2020. And that was primarily due to a loss of employment and thus losing private insurance. So the percent of privately insured children in that time frame decreased from 56% to 47%. So we saw that drop primarily due to loss of employment from the pandemic, resulting in loss of private health care. In 2019, about 7 in 10 uninsured children remained uninsured, even though they were eligible for coverage through Cover Care or TennCare. So children who are eligible for TennCare and Cover Kids, the outreach efforts should communicate that eligibility in an easily accessible way, taking into consideration some of that data earlier about the number of Tennessee families who are not speaking English at home. And then in fall of 2020, 1 in 5 parents in these programs reported a loss in coverage over the last 2 years, and more than a third of those attributed the loss to an issue with paperwork. And so Tennessee currently has 12-month continuous eligibility for Cover Kids, and that allows children in that program to maintain healthcare coverage for a full 12 months after enrollment, despite any temporary fluctuations in their caregiver's income. And due to the COVID-19 public health emergency, this eligibility has been extended to all Medicaid recipients across the nation. So while we're in this state of emergency, people have not been losing their healthcare coverage due to temporary fluctuations. But after the pandemic, children with TennCare coverage won't have this protection and will become more vulnerable to coverage gaps. And we'll see when children have those coverage gaps, they may miss a well child visit, may miss a vaccination appointment. So to ensure that coverage for all youth, Tennessee can implement 12-month continuous eligibility for TennCare, particularly since those lower income individuals are more likely to face fluctuations in income. And so we talked about the majority of births in Tennessee being covered by TennCare. And now we're going to look at infant and maternal care in Tennessee. And so Tennessee in 2019, 9.2% of babies were born at a low birth weight. Tennessee consistently struggles in this indicator and ranks in the lowest quarter of states for babies born at a low birth weight. During the statewide stay-at-home orders in Tennessee from March 22nd until April 8th of 2020, the rate of preterm birth was lower than that of the previous 5 years. So the rate was around 10.2% compared to 11.3% the same month in those previous 5 years. And so Tennessee was seeing fewer preterm births during that stay-at-home time, but the infants born during that time needed more respiratory assistance at birth. And then the Centers for Disease Control have been collecting data across the US, and they found that people who have COVID while they're pregnant are at an increased risk for severe illness from COVID, preterm birth, or stillbirth. And so we're still collecting the data, but we're seeing the impacts of COVID on both the mother and the baby. And then both the rate of pregnancy and births among girls 15 to 17 has been cut in half over the last decade. The rate has dropped from 20.2 births per 1,000 in 2010 to 9 births per 1,000 in 2020. So we're seeing that decrease. That decrease is occurring in Tennessee, but it's also matching a national pattern that's occurring across the country. And then when we look at maternal mortality, the number of deaths, maternal deaths decreased from 82 in 2018 to 62 in 2019. And when we look at maternal mortality, there's a few different categories. So we have pregnancy-associated deaths, and that is any death that occurs in a woman from becoming pregnant until 1 year after birth. And then pregnancy-related deaths are in that category of pregnancy-associated, but it's pulling out those more specific, directly attributable to being pregnant is why the woman died. So in 2019, 37% of all cases of maternal mortality were pregnancy-related. So that's specific to being pregnant. And then 53% were pregnancy associated but not related. The other remaining percentage they couldn't determine. The leading cause of pregnancy-related deaths is cardiovascular or coronary conditions. And then for pregnancy-associated deaths, the leading cause of death was overdose. And then more than 1 in 3 cases of pregnancy-associated deaths in 2019 had substance use as a contributing factor. And 1 in 6 pregnancy-associated deaths were classified as intentional and violent, with 3 out of 5 of those involving a firearm. And of all pregnancy-associated deaths, more than 2 out of 3 of those were covered by TennCare after birth. So of all births, TennCare covers half, but there's an increased percentage of TennCare births represented in pregnancy-associated deaths. So in all of the 3 different categories, pregnancy-associated, which is that broad umbrella, pregnancy-related, and then pregnancy-related not associated. Sorry, pregnancy-associated not related. The most fatal time period was 1.5 months to 12 months after birth. And so 61% of deaths occurred in that time frame. Previously, TennCare coverage expired 60 days after birth for women, so just about 2 weeks before the most fatal time period. And the pregnancy-associated mortality ratio for a woman on TennCare was 2.5 times higher than those who are on private insurance. But we've seen that TennCare has extended a new pilot program. It'll take effect in March, and this program will extend coverage for women up to 12 months after birth. And so we hope to see a reduction in these pregnancy-associated births because approximately 79%, I believe, 79% of these deaths were found to be preventable. And then it's almost impossible to look at maternal mortality in Tennessee without being struck by the disparities in maternal mortality data. So in Tennessee, Black women are at increased risk of health complications associated with pregnancy. In 2019, they comprised 32% of all pregnancy-associated deaths. When you begin to look at just pregnancy-related deaths, the disparity increases significantly. In 2017 to 2019, there were about 18 non-Hispanic white deaths per 100,000 births. And comparatively, there were about 70 non-Hispanic Black women who died per 100,000 births. So there's a huge increase, and Black women in Tennessee are 4 times more likely to die from a pregnancy-related cause than white women. And it's almost always a cause that's directly attributable to the pregnancy or to a health-related condition to the pregnancy. So the most frequent causes of death were heart disease, preeclampsia and eclampsia, embolism, infection, or homicide. And so looking at dental care, 1 in 4 Tennessee children did not receive preventative dental care in 2019 to 2020. and Tennessee falls below the average on this indicator and ranks 44th in the nation. And this rate of preventative care closely aligns with the percent of Tennessee parents who report that their children's teeth are in excellent or very good condition. So 76% of parents said that their children had teeth that were in very good condition, and 1 in 4 children were receiving, or did, I'm sorry, I got confused. Yes, 3 out of 4 received preventative care. So then looking at another area that Tennessee does really well is in community water fluoridation. It's a safe and equitable, cost-effective way to support oral health across a community. So it is the process of adjusting the amount of fluoride in drinking water to a level that's recommended to prevent tooth decay. And the CDC has named it one of the 10 greatest public health achievements of the 20th century. In Tennessee, 88.9% of people are served by community water systems that are recipients of fluoridated water. And the United States has set a goal of 77% of the population to be served by these water systems by 2030. And so Tennessee has already far exceeded that goal. And additionally, with dental care, there was a pretty drastic drop in care due to the pandemic. During the week of April 6, 2020, there was a 94.5 decrease in dental visits compared to the same week that previous year. And we've seen that as the pandemic has gone on, the rate of dental visits among privately insured individuals has gone back up to baseline, whereas those who are publicly insured has still lagged below previous years. And so looking at ensuring access to dental care for those who are pregnant or just had a baby is critical for the health of the parent and the child. Pregnancy can cause many oral health issues such as gingivitis, periodontitis, morning sickness that weakens the tooth enamel, and then bacteria from the mother's mouth can impact a baby in utero by traveling through the bloodstream, producing chemicals that are suspected of inducing premature labor. Postpartum, the mother can pass that bacteria through kisses and things like that. And so previously, TN coverage for mothers did not include dental care, but with that pilot that's extending coverage for 12 months, it is also extending dental care coverage benefits. And so that makes it a significant step towards increasing maternal and child health. So in 2019, Tennessee really fell behind and had the highest rate of foster care instability in the nation. And so that is defining foster care instability as 3 or more placements within the first 12 months of care. And so we were much higher than the national average and the highest within the nation. In 2020, we had a little over 130,000 hotline calls, and that resulted in about 6,900 substantiated cases of abuse or neglect. Those numbers aren't directly comparable because the hotline calls is looking at fiscal year, whereas the number of substantiated cases of abuse or neglect is looking at the calendar year. So they aren't a direct match. When we look at domestic violence, Tennessee had some really concerning statistics that I wasn't aware of previously. So more than 1 in 6 Tennessee high school girls reported experiencing physical dating violence in the last year. That number is significantly higher than anywhere else in the nation, and it's twice as high as the national rate. That is just looking at what the survey called physical dating violence. Tennessee did not report any data on sexual violence or emotional abuse. Additionally, children were nearly 1 in 10 of domestic violence victims in 2020. And they also, 8.1% of reported domestic violence victims were youth whose offender was their parent or their step-parent. And then when we look at human trafficking, in both 2018 and 2019, Tennessee received the #1 ranking from Shared Hope International state report cards. This annual report ranks every state assessing law enforcement approaches, legislation, and survivor services. So we've previously done really well. In 2021, the report saw Tennessee's rank drop to a D. This is the lowest rank the state has received since the report began, but this drop was due to a more intensive grading process. So Shared Hope International kind of upped the rigor of what they were grading states on, and provided some advanced legislative framework that really wants Tennessee to implement. And so Tennessee still ranks among the top 10 states for child and youth sex trafficking protections. And we've seen some of those recommendations by Shared Hope being filed as legislation this year. So we expect that grade will increase in the coming years. And so, but when we look at the data, we can see that Tennessee had 180 trafficking cases in 2019. 131 of those were solely sex trafficking, with 4 that were a mix of sex and labor trafficking. And although the majority of the cases were adults, there was 53 cases of child trafficking in 2019. And then the most common form of sex trafficking in Tennessee was residence-based and commercial. And then when we're looking at labor trafficking in Tennessee, that was most frequently occurring in traveling sales crews. And so when we're looking at the impact of the pandemic on foster care, the Supporting Foster Youth and Families Through the Pandemic Act was a piece of federal legislation which extended foster care supports for those who had aged out of the system. And so it allowed extension of foster care services to be offered to those up to 27 years old, and also waived the work or school requirements. Tennessee received $7.4 million in federal funding to support former foster youth. And by mid-November 2021, a little over 1,000 former foster youth had received a stimulus payment from that money, and about 430 who were currently enrolled in extension of foster care received another payment as well. And so when we look at youth justice data in Tennessee, it is extremely hard to get a full picture of what is going on because there's a lot of challenges with the data. And that was something we really talked about in the State of the Child, of if we want to make sure that we have an equitable, supportive youth justice system, that we need more data to really monitor what we're doing. But this is a one-day snapshot of youth justice placements in Tennessee. I believe the day that this was taken was April 4th, 2020. So you can see that 48% of those youth were in community placement, 18% were in a youth development center, and 19% were in a juvenile justice enhanced or staff secure place. And so looking at the costs provided by DCS for community placements versus youth development centers, we can see that the average cost to detain a child in a hardware secure facility is $180,675 a year. And then when we look at Tennessee's youth justice system, like I mentioned, it really struggles with a lack of reliable data. So providing a representation of racial disparities becomes really challenging. The data on this slide is the most recent juvenile court referral data from 2020. And there are 98 juvenile courts in Tennessee, and 78 of them are reporting this data to us. And so it comes with its challenges, but we can see that Tennessee follows a national trend of racial and ethnic disparities within the youth justice system. Youth of color, particularly Black youth, are disproportionately represented in the youth justice system and are more likely to receive harsher sentences for similar offenses. So in the first graph here, there is the percentage of cases resulting in secure detention. And African-American youth made up 71% of those cases. And then as you step further into the system to a more severe punishment of being transferred to adult court, African-American youth made up 85% of those cases transferred to adult court. So as cases progress, the disparity increases. But then looking at of those counties reporting, so the 78 courts, looking at the counties that those courts represent, Black children were only 22% of the population. So they're making up 22% of the population, but representing 85% of cases transferred to adult court. And we've seen data from other states that there's racial disparity even when you control for the type of case, previous offenses. So it's really coming down to just those racial differences once you control for everything else. And so although this data needs to be taken in context with all of the other extenuating challenges, it is representative of a longstanding issue both in Tennessee and nationally in the youth and adult justice system. And so we've seen that community involvement and educational attainment among young adults are both at a 20-year high. So the percentage of 25 to 34-year-olds with an associate's, bachelor, or graduate degree is the highest it's been in 20 years. The number of young adults voting in midterm elections increased by 158% between 2014 to 2018. And the 2020 presidential election had the highest young adult turnout in 20 years, and turnout was double that of the 2000 election. And we're also seeing that youth, approximately 50%, reported being involved in community service projects, either through their nonprofit interests, community organizations, churches, nonprofits, or schools. So we're seeing that they're achieving high educational attainment and involved in their community, which is really exciting to see. That is everything I have right now for the state of the child. And just a little bit, I will talk about some of our policy briefs and the legislative work that we're doing there. But I wanted to take a break and answer any questions you all might have before I throw any more data at you. So I'm going to pull up the chat and see. I see the question about the PowerPoint. Let me see.
If anyone has a question, you can unmute at this time and ask Kylie your question.
And I see some comments here from a expectant mother, which is so exciting, but about the wait list and the challenge with care. And that's in Davidson County, which has its own struggles, but as far as child care deserts, it did fall on the lower side. But we see Davidson County has the facilities, but it's hitting that child care desert because there's more children than places. Whereas in the rural communities, it's sometimes a lack of any facility. But the costs are so difficult for new families. And then, yeah, practices to put funding in preventative care rather than reactive services. I'm not sure exactly where this comment came in the presentation, but I feel like there's several spots that it could fit. So yeah, just in almost everything we talk about, the investment in preventative care is crucial, and addressing, they almost all interrelate. And then, yeah, absolutely, I can get a copy of this PowerPoint over. I'm going to type in to the chat real quick the link to the report that doesn't have the PowerPoint, but I will get that to you all. And then I'll pause for a second if there's any questions, and if not, I'll pick back up.
And Kylie, while we're waiting on questions, I just want to thank you for making this data accessible, because I've read the report, but you explaining it, somehow that actually translates. It's all about understanding it. And so thank you for going into depth with that, because so many of this data means a lot to our world, especially in child welfare or serving children through the councils. And like one of the things you mentioned was about healthcare access. And so TCCY's regional council with MCCY, our group, will be having a healthcare access training on April 22nd. So, getting involved in how you can help maybe advocate for some of these issues in your area of practice, I think is really important, and seeing those opportunities, because our legislators do want to hear from their constituents about things that are concerning in their area. So thank you for making this relatable to the rest of us, all this data.
Yeah, of course. I really like data, but my mind doesn't work the same as some of our really data-heavy people in our office. I kind of have to make it simple for myself to understand it. And so I think that just helps translate it to other people too, because I need it in a more accessible way. Otherwise my eyes will just glaze over. Yeah, and so I think, and when you talk about access to care, that's one of the data points that we've worked with for years now, and has always just really frustrated me, is the number of kids who remain uninsured even though they're eligible for this coverage. And so just figuring out where the breakdown is and why are they not being covered? Is it that the enrollment is in online and they don't have access, or do they not know, or do they not understand? And so just that one has always bothered me, that it's like we have this service, but it's not being used as well as it should be. Well, if there are not any questions, also feel free I'll put my email in the chat later, but I will go through some of our policy briefs, which is a newer thing that we are doing. Let me fix this so you don't see everything else. So I guess about 2 years ago now, Tennessee Commission on Children and Youth updated our mission and vision. And so our new mission is that we lead systems improvement for all children and families through data-driven advocacy, education, and collaboration. And the vision being that we strive to become the premier leader in children and youth systems improvement through innovative and transformative approaches. And so as we were going through this, we really wanted to look at what does our role in, we have all of this data, and I'll put a link to the chat as well. We work with the Kids Count data center in their network. And so we have tons of county level, state level indicators. And so we have all of this data, and the TCCY team is incredible. We have so many people who have expertise in different issues or challenges. And so really wanted to look at what does our role look like, and how can we be most effective in communicating that data and that knowledge, and still aligning with our mission of data-driven advocacy. And so we really started to look at what do we look like as a resource for Tennessee policymakers, and that could be policymakers in the legislature, that could be organizational policymakers, and then also just the information that we can provide to help people who are doing those on the ground services and direct client contact. So when we began developing these policy briefs, really went into it with the main priorities and goals of being a resource, being evidence-based. We wanted them to be easily consumable, and that's it's a challenge to be easily consumable, quick, and easy to understand, while remaining evidence-based and providing some of the more in-depth resources and evidence and research that's out there. And so that was kind of a challenge that we have to go back and forth a lot. But we, really started to look at how the world is communicating information, and how we consume information now is so much quicker, that some of these previous reports that we wrote that were really text heavy were so well written and so in depth, but they weren't getting read. And so we really need to look at how can we engage people How can we make these reports easily to consume, could be read on a phone if needed, or if you have 5 minutes, we want to get your attention. So we wanted them to be engaging. We also know that these last two bullet points go together with ever-changing and data-driven. And so we have the ability to print these reports, but we haven't quite printed them yet. We've kept them on our website because we're in such a flux time with data right now that we're trying to keep them as up to date as possible. And that means that if we have them online, we can continually update that data as it becomes available. So what we have right now for policy briefs, we have infant and maternal health. We have one on early childhood and early childhood education, child welfare, human trafficking, family-friendly workplaces, and the youth justice system. And so in infant and maternal health, we look at prenatal care, doula care, postpartum care, opioid use disorder, the importance of evidence-based home visiting, breastfeeding, and paid family leave. Then when we look at early childhood education, we look at why it matters, some of the short-term academic gains that you see from implementing pre-K, the current state of licensed childcare, the importance of quality childcare, quality monitoring, the impact of COVID-19 on early childhood education, the Child Care Development Block Grant, and then next steps. In child welfare, we look at the data surrounding what does the child welfare system in Tennessee look like, and abuse and neglect data. We look at types of maltreatment, the risk factors or protective factors that may be involved in a child's life. The Centers for Disease Control has strategies to prevent abuse and neglect, and so we dive into those a bit. We look at what the educator's role is in preventing child abuse and the importance of access and training, and then relative caregiver support as well. And then in human trafficking, we once again look at the data. What are we seeing in Tennessee in regards to human trafficking? And then we look at defining the problem, so we really understand when we're using these terms, what are we talking about, because it can get really mixed up and muddied. So we talk about the differences between human trafficking, child sex trafficking, and commercially sexually exploited children. We talk about trauma-informed policy recommendations, including trauma-informed cognitive behavioral therapy, law enforcement training, medical professional training, expanding protection of commercially sexually exploited children, and trauma-informed court practices. And this is one of those ones that I really feel like represents the ever-changing, because we had this brief and it was published, and then when Shared Hope put out their advanced legislative framework, we really went back in and looked at this and looked to see if our recommendations were matching what theirs were, or if we needed to up the recommendations or change the wording a bit to more reflect what they're seeing out in the field. And so we went through and updated this to reflect some of those changes. In family-friendly workplaces, we talk about the importance of family leave and the rarity that the United States does not have it. We talk about the importance of childcare, breastfeeding support in the workplace, and then supportive scheduling. So predictive scheduling, allowing parents to work around schedules, things of that nature. In youth justice, we talk about brain development and how youth are less culpable, and some of the court cases that have gone on to show that. Talk about the detention reduction, some of the data. In this section, we're talking a lot about the need for data around youth justice. Talk about the school to prison pipeline, suspensions, expulsions, and resulting in detention. And then the importance of maintaining necessary contacts and support while youth are incarcerated. So access to family visits, phone calls, things like that. And so what we're working on right now, we are working on creating a giant mental health brief that can be broken down into different sections as people are interested. So we have an overview of mental health, then we look at what does infant and early childhood mental health look like. Then we look at some of the challenges and what we see in middle childhood or that elementary age. And then diving into adolescence and young adult mental health. And then we're hoping to break that out a little bit and talk about substance use and substance use disorder among adolescents. We also have one in the works on mentoring programs and the importance of those for youth, and then one on opioid use disorder and pregnancy. And so with the mental health brief, we do an overview, we look at the data and the numbers that we're seeing, talk about disorders that may appear in childhood, how to improve mental health, positive mental health, and then access to care. And then when we were talking about the adolescents or young adults section, talking about why is support critical during these years, looking at the average age of onset for disorders, the data around some of that suicidal ideation data, the prevalence of different mental health conditions, the importance of care before crisis and access to treatment for kids before they reach a crisis point, including screening in schools or at your pediatrician visits, things like that. And then also accessing appropriate treatment. So making sure that kids are not kept in a more severe treatment place longer than needed, but also that they're not being kept in ERs waiting for treatment beds to become available. In opioid use disorder and pregnancy, we look at neonatal abstinence syndrome. It has drastically increased over the the past decade or so. The rate of NAS in Tennessee has really increased. We look at the cost of neonatal abstinence syndrome, the cost of taking care of an infant with that, diving into child welfare and the opioid epidemic, and the large percent of children that are in the welfare system solely due to drug use, and how the welfare system was not particularly created to handle these challenges. And then we look at barriers to treatment for women, which can include their pregnancy status, kind of similar to childcare deserts, that they may not be available, or the cost, and then also ongoing support postpartum. So looking at evidence-based home visiting, safe baby courts, things of that nature. And then youth mentoring, do a background on mentoring. What do we know? Evidence-based practices for youth mentoring, highlighting some innovative programs, and then moving forward what we need to see in that world. And then moving forward for us, what's next is we hope to create a brief on child health. So looking at access to food, access to healthcare, nutrition, physical activity, and then also some of our regional coordinators have highlighted that we've seen an alarming number of teens smoking or using vapes, and so highlighting the impact of that. And then we also want to look at community safety and highlighting the importance of safe storage practices for firearms and some other ways to make communities safer. And so that is the end of my slideshow. I am going to stop sharing my screen for just a moment, and then I'm going to show you, I'm going to pull up on our website where you can find these policy briefs. Right now, it just has those first group that we went over, the ones that we're working on. I really just need to go in and make sure all of our citations are in there and do some last minute formatting. So hopefully those will be available to you all soon. And then we don't currently have, for the child health and the community safety, we haven't started the development process for that yet. So those should be coming, but I don't have an estimate for when yet. But I'm going to share my screen once again real quick, and you should be able to see. So this is our homepage here. And if you go to Advocate and Collaborate here at the very bottom, and I'll include this link as well, you can click on Policy Briefs, and here are the ones that we are currently working on. And so when you click through, just to give you an example of kind of what they look like and what I was talking about with being easily consumable, this is the child welfare brief. So we have our executive summary highlighting some of the data, types of maltreatment, risk factors, protective factors, the Centers for Disease Control strategies, children who participated in preschool data, educators' role, relative caregiver support, and then our references. And similar here, they all range in size about 7 pages or so. Family-friendly workplaces is one of our shorter ones. We really wanted that to be like 2 pages front and back. So we have workplace. We talk about paid family leave and the recommendations. Here's some of the childcare data and our recommendations there, and then breastfeeding support and supportive scheduling. So that is everything I have right now. Did you all have any questions about going back to the state of the child, about our policy briefs, why we're doing this, where we see this going?
Please feel free to unmute if you have questions, and you can ask your question.
I just put a link in the chat to that policy brief website so that you all will have that as well.
Thank you so much, Kylie.
And I did want to remind people that if you have not registered for Children's Advocacy Days with TCCY, that's a great opportunity to learn more in depth about some of the policy briefs. I know you have a variety of speakers that will be talking on topics related to children and families and youth. And I believe that the in-person is now full, but you have the opportunity to attend virtually. So registration, I believe, is available on the TCC website along with all of these policy briefs. And I know that TCCY has committed to the communications piece. So data, as we said, is only as good as you can communicate it. So these briefs really condense it down into digestible information. And then with your social media sites, that information can be shared across platforms as well.
While we're waiting on folks that might have a question, I want to remind everybody, if you have not yet entered your name, your email address, and your agency in the chat box for us, we would appreciate that. I will be sending out certificates for those who need verification that you attended this session today. That will be a participant certificates. Unfortunately, we did not have the opportunity to get CEU certificates for this event. Also, as Kylie has put in the chat box, the address where you can find the State of the Child report. If you have any difficulty with that, I will put my email address in the chat box, and you can email me directly, and I will help you to locate that. And we thank you all for coming. I want to thank Kylie for a great presentation, and I want to thank Wendy for always being a great MCCY leader. And Wendy or Kylie, do you have any final remarks?
I do not. Thank you for letting me present. I really enjoyed it.
We've enjoyed having you. I do have a final remark. So if you're saying, wow, we have a lot of problems to tackle, there are things that you can do. There are ways that you can get engaged. So TCCY does operate a number of councils that some of you are involved in, that you may be involved with, where you make recommendations that go to the legislature. And so your voice is heard in that way. Also, if you serve in the leadership on one of the regional councils, or if you're a member of the regional council, each council holds an annual legislative event that you have the opportunity to be a part of. And those councils invite legislators to hear your thoughts and concerns and really provide a perspective on what's being done in Tennessee. And so we think there are lots of ways that you can get involved and engaged in advocating for good policy in Tennessee and access to care and things like that. So If you do not know your regional council, there's a lot of information at TCCY's website. You can look up your regional council, and they have the names of the regional coordinators and get involved in that way. So lots of opportunity. And yes, Kylie, thank you so much for providing this most helpful update. And we're happy to stay on just a little bit longer if there are any further questions outstanding.
If you do not have any questions, feel free to exit, and thank you so much for spending your morning with us. Ladies, I think it was a very successful morning, and I want